All right, good evening, everyone, and welcome. Thank you for joining this important conversation about understanding the COVID-19 vaccine. We'll be joined tonight by Dr. Paulette Chandler and Julian Dedier. This event is a collaboration of Grace Church of All Nations, All of Us New England, and Dot House Health. My name is Helena Joseph, a member of Grace Church of All Nations, and for purpose of this event, I'm also a patient engagement project manager, and I'll be tonight's discussion moderator. The event will be recorded. All microphones will be muted during the event. If you wish to maintain anonymity, you may turn off your camera. Please note participants will be able to ask questions during the event. And before we present our special guest, I'd like to just give you some background information about each one. Dr. Julian Dedier, he's the Assistant Professor of Medicine at Boston University School of Medicine. Dr. Dedier received his medical degree from Northwestern University. He completed residency training in internal medicine at the Massachusetts General Hospital and obtained a Master's of Public Health degree in quantitative research methods at Harvard School of Public Health. His research interests has included understanding the influence of ethnic, cultural, and environmental factors on risk-related behavior for cardiovascular disease and cancer among underprivileged urban minority groups. Dr. Paulette Chandler is a medical advisor and nutrition director. Dr. Chandler is also a primary care physician and cancer epidemiologist with a focus on preventive medicine. Dr. Chandler studies the connection between nutrition and cancer prevention at Brigham and Women's Hospital in Boston, and she's an assistant professor of medicine at Harvard Medical School. Dr. Chandler is passionate about educating the public about the power of healthy lifestyle choices for preventing disease and promoting wellness. To get started, I'd like to welcome Dr. Dedier. Please take it away.
Good evening, everyone, and thank you to the organizers of this event. It is my pleasure to share in this discussion with you tonight. Such an important topic it is. And without further ado, let's dive right in. I want first to acknowledge my colleagues in the section of infectious diseases at Mass General Brigham Hospital for providing these slides. Let's have the next slide, please. So, COVID, as you all know, has dominated our lives over a year now, approaching 30 million cases and just over 500,000 deaths in our country alone. Unfortunately, Black and Brown people are at particularly high risk of getting COVID-19 and dying from it. And I wouldn't be surprised if many of you, if not all of you, are touched in some way by this epidemic. Vaccines are a big way out of the current pandemic. But people have a lot of questions, and rightly so, that might prevent them from getting the COVID-19 vaccine. And so what we want to discuss here tonight are those questions. Next slide, please. And of course, it's perfectly natural and understandable to have questions and concerns about this vaccine. And part of this comes from the rapidly emerging information, which seems to be changing on a daily basis, but also because of the deep-seated disparities and, quite frankly, mistrust of medicine in our communities here in the United States. And so I want to just stress first and foremost that tonight's discussion is a safe space. It's a place where you can voice your concerns, whatever they may be, because this is the way that we dispel myths. And what we want is to provide good quality information that can help you make sound decisions based on what's true about the COVID vaccine. Next slide, please. So this presentation will cover the following things: COVID in our communities of color, types of vaccines and how they are made and developed, what an mRNA vaccine is and how they work, how good the vaccines are, what are the potential side effects of the vaccine, Dr. Chandler will be discussing common myths and frequently asked questions about the vaccine, and also vaccination in Massachusetts. Next slide, please. May I have the next slide? So let's start by establishing why it's so important to discuss COVID vaccines, particularly in our communities of color. As you'll see, COVID-19 is a particular problem in our communities. Next slide. So compared to white people, the burden of COVID-19 is higher in the Black community. You can see here that in the Black community, COVID happens 1.1 times more often than in the white community. Blacks are hospitalized 2.9 times the rate of white people and die at 1.9 times the rate of white people. And thinking about these numbers in another way, for every 10 white people that get COVID, 11 Black people get COVID. For every 10 white people that are hospitalized, 29 Black people are hospitalized for COVID. And for every 10 white people that die from COVID, 19 Black people die from COVID. Advance the slide. And the problem is just as bad for the Latino community, where Latinos are 1.3 times more likely than whites to get COVID, 3.2 times more likely to be hospitalized than whites, and 2.3 times more likely to die of COVID across the United States than white people. Next slide, please. This table shows deaths from COVID-19 by race and ethnicity in Boston as of February 25th. Although whites make up about 52% of Boston's population, they're only responsible for 44% of the deaths from COVID in Boston. Blacks, on the other hand, make up 25% of Boston's population. Advance the slide, please, or just quick one. Yeah, quick one more time. Thank you. Blacks comprise 25% of Boston's population, but account for a disproportionate number of COVID deaths at 33%. And according to these data, COVID deaths among Latinx people is proportional to their overall percent of the population in Boston. However, nationwide, of course, we just saw that the death toll is much greater than percent population among Latinx people too. Next slide, please. And the next slide. Now we'll focus on the COVID vaccine. So I'm sure many, if not all of you, were vaccinated against the 6 childhood killer diseases: measles, mumps, rubella, polio, diphtheria, tetanus, and whooping cough. Vaccines work by teaching the body to recognize and fight a virus or bacteria before ever being exposed to the actual disease in real life. So this picture shows us how vaccines work. Essentially, you're given a small amount of a harmless pathogen or foreign invader, like a vaccine or a virus, a bacteria or a virus. And then your body is able to make antibodies to fight off the foreign invader. Then, if you encounter the disease again, your body already has the antibodies to fight the disease, so you don't get sick. Let's have the next slide. We first find out what causes the infection. So this slide focuses on how vaccines are developed. And the first step in this process is to find out what causes the infection, that is to identify the pathogen, virus, bacteria, or whatever it may be. Next step is to figure out how to make a form of that pathogen that can't cause infection, either by taking a piece of it or making the whole pathogen very weak. The next step is to test the vaccine under development in animals to find out whether it works. The final step is then to conduct clinical trials to test the vaccine in beings to see if it's safe and effective. Next slide. So clinical trials are done in human beings. They're done in a phased manner to learn about the vaccine's suitability for use in the whole population. There are generally 4 phases of clinical trials. must occur before a vaccine is authorized for use in the general population. In phase 1, it's tested on a small number of people, about 20 to 100 volunteers, with a focus on safety and to see what doses are appropriate. In phase 2, more volunteers, up to several hundred, are tested to find out additional side effects, whether there's an immune response. Phase 3 typically includes thousands of volunteers who are given the vaccine to find out whether the vaccine works. And importantly, after a vaccine gets approved, there's phase 4, where researchers continue to collect information about the long-term benefits and safety of the vaccine, even after it's in widespread use. Next slide. This figure shows the full process to develop a typical vaccine, starting from early lab work in animals to testing in humans. And that process, as you can see in the top bar, usually takes about 73 months, which is around 6 years. But due to a federal program called Operation Warp Speed, this process was condensed into a much shorter period of time in developing the COVID vaccine without skipping any steps in the process. The goal of Operation Warp Speed was to produce and deliver 300 million doses of safe and effective vaccines by January 2021. And under this program, the US government was able to fund vaccine manufacturers to develop vaccines faster and begin mass production earlier in the process. So vaccines that were proven effective could be distributed without delay. What I want to stress in this picture is that even though the accelerated process shown in the second bar is 14 months compared to 73 months in the typical case, all of the phases that are required to approve a vaccine were and are being followed. Next slide. So a little bit more detail on how the mRNA vaccines that we have today were developed so quickly. It's important to know that scientists have been studying similar coronaviruses for over 50 years. And the COVID coronavirus, SARS-CoV-2 genetic sequence, which was key to developing the vaccine, was shared very quickly with scientists all over the world so that folks could begin to work on a specific mRNA vaccine right away. The technology to create mRNA vaccines has been around for the last 30 years. Human trials of other mRNA vaccine technology has been ongoing for at least the last 10 years, like the Zika vaccine and rabies vaccine, both of which are mRNA vaccines. And manufacturing of the COVID vaccine began well before the trials were finished. So in case the vaccine was found to be effective, there would already be vaccine in stock that could be distributed quickly. Next slide. So how do mRNA vaccines work? It all begins with looking at the coronavirus, which has an important protein on its surface called the spike protein. This is the protein that it uses to enter human cells and cause disease. The mRNA used in vaccines carries instructions that tell our cells how to make the spike protein. Just the spike protein, not the entire coronavirus. Our cells pick up that mRNA that's injected in the vaccine and uses that genetic code to make the protein and display that protein on the surface of our cells, only in the spot of our body where the vaccine is injected. So this all occurs in the arm where the vaccine is injected. The mRNA then gets degraded very quickly and doesn't become part of our cell. Our immune system then recognizes the proteins, these spike proteins that the body has created, and it makes antibodies against them, so that if we later come in contact with the real life coronavirus, our body recognizes it, attacks it, and destroys it before it can cause disease. Next slide. So knowing that, there's some key things to remember about mRNA COVID vaccines. One, the enzymes in the body destroy and eliminate the vaccine mRNA after the spike protein is made. So there's really no remnant of the vaccine after a period of time because the body degrades what was injected. No live virus is involved in the vaccine. What's injected is just viral mRNA, which means that you can't get COVID from the COVID vaccine. And it's important to remember that no mRNA enters the cell, the center of the cell, where our DNA is. So there's no interaction with our own genetic material. Our genes don't incorporate the COVID mRNA. So there's now a third COVID vaccine that was just approved for emergency use this week, the Johnson & Johnson vaccine. It's not an mRNA vaccine, it's a viral vector vaccine. This vaccine is made of the genetic code that makes the COVID virus spike protein. It's put inside the shell of an inactivated virus that usually causes the common cold, but in this form can't cause any illness at all. The inactivated virus takes the spike protein genetic code into human cells at the site of injection, where our cells once again manufacture the coronavirus spike protein. Then, like the mRNA vaccines, the body's immune system builds up its defenses against the spike protein and will attack the real COVID virus if it's ever exposed to it in life. Next slide. This slide shows information about the 3 vaccines now authorized for use in the US. The top row shows the vaccine name, so you see Pfizer, Moderna, Johnson & Johnson in yellow. And the columns show the different characteristics that I will go through at this point. So the first row is age groups. So the Pfizer vaccine is authorized for use in people 16 years old or older. Moderna and Johnson & Johnson, age 18 and above. The Pfizer vaccine is a 2-dose vaccine. Both doses are currently recommended for full immunity. So is the Moderna vaccine. However, the Johnson & Johnson is approved for 1 dose only. That is, it only requires 1 shot. And after when is protection maximal? In the case of the Pfizer vaccine, it's about a week after the 2nd dose. So that's about 5 weeks in, I believe. In the Moderna, it's about 2 weeks after the 2nd dose. 4 weeks for Pfizer, 5 weeks for Moderna. And Johnson & Johnson, it's about 28 days after the dose is given, is when full immunity is achieved. These vaccines are all extremely effective in preventing moderate or severe COVID disease. The Pfizer, 95%, Moderna, 94%, and Johnson & Johnson, 72% here in the United States. It's important to note that no one in the Johnson & Johnson trial died or was hospitalized if they received the Johnson & Johnson vaccine. Next slide, please. So the next question is, will the vaccines be effective in people of color? And of course, it is critical to enroll diverse individuals in vaccine trials to make sure that these vaccines would be safe and effective for all populations. And thankfully, the Moderna and Pfizer trials did exactly that. So here you can see that the Moderna trial on the left enrolled approximately 30,000 participants. 10% of them were African American or Black, 20% Latino. And you see the breakdown of Asians, etc. So 63% were white. In the Pfizer trial, which is depicted on the right, 13% were Latino, 10% of those enrolled were Black. And the good news is that both vaccines were found to be safe and effective across all racial groups and across multiple medical conditions like diabetes, high blood pressure, and obesity. So we were assured from these data that the vaccine is indeed effective in our communities of color. Next slide. What about the Johnson & Johnson vaccine? Similarly, in the Johnson & Johnson trial, 20% of the participants were Black or African American. A full 45% were of Hispanic or Latino ethnicity. Again, the vaccines seem to work equally well in everyone. So these data tell us that the COVID vaccines authorized for use in the United States are effective in diverse groups of people. Next slide. So we've talked about the devastating impact of COVID-19 in our communities of color. We've discussed some basic facts about how the COVID vaccines were developed. And I've shown you the available vaccines are highly effective in preventing people from getting sick with COVID. Now, my colleague, Dr. Chandler, will continue with a discussion of potential vaccine side effects and some common questions about the vaccines. Dr. Chandler.
Awesome. So, common side effects of the vaccine. The most common one is pain at the injection site. And that soreness lasts for a couple of days and then it resolves. And some people may take Tylenol for the pain, others just work through it. Fatigue and headache is less common, and the headache again lasts for a couple of days. Some people may have it for a little bit longer, but in general, these are not long lasting side effects. Some people experience worse side effects after the second dose, because remember, the first dose is just sort of taking your immune system to school. The second dose is really training it, reminding it of what it experienced the first time it saw the vaccine. So for the second dose, some people say, oh, they had some chills, sweats, fever, and some people have no side effects after the second dose. These are not life-threatening, and the recommendation, as I mentioned, is acetaminophen or ibuprofen after vaccination. Now, what about local arm reactions? This can occur up to 9 days after the vaccine, and it can take several days to go away. Some redness at the site, some thickening, induration of the skin. It's benign, it's not harmful. It may be associated with itching or some pain. This is not a reason to not get the second dose. And some have said this seems to be more common with the Moderna. But in general, that local arm reaction is just evidence that your immune system is responding to the vaccine. What about vaccine-associated anaphylaxis? Of course, this is the big fear for people. They've heard about people having to go to the emergency room after the vaccine, but this is a rare event also. So this is a life-threatening allergic reaction that starts within minutes of exposure. You might have some itching of the skin, swelling in the lips, the feeling like your throat is closing. And if you've had a history of allergies to a couple of the ingredients, polyethylene glycol, which is one of the ingredients in the vaccine, or polysorbate, then you should not get the vaccine because these two allergies are associated with anaphylaxis. So when you look at the COVID-19 vaccine adverse event reporting system, which is run by the CDC, you look at all the events that have been reported, and they're about 4.7 cases per million in the Pfizer and about 2.5 cases per million for the Moderna in terms of individuals that have had this severe allergic reaction. Now, if you compare that to other common vaccines like the flu vaccine, that's 1.3 per million doses in terms of allergic reactions, or IV penicillin, 1 event per million doses. The risk of either becoming ill with COVID or dying of COVID is far greater than the risk of a severe reaction to the vaccine. Risk of death due to COVID-19 is 3.4% or higher versus risk of severe anaphylaxis reaction, remember, swelling, shortness of breath, needing to use an EpiPen or possible steroids, no greater than 5 per million. Who should not get the Moderna or Pfizer vaccine? You people. Do not get the Moderna or Pfizer vaccine if you have a significant allergic response, such as anaphylaxis, to the first dose. Or you have, I'm sorry, I'm admitting people. I've admitted these people before, but they keep coming back in, so I'm not sure what's going on there. But anyway, lesser side effects with the first dose are not reasons to not get the second dose. If you have known allergies to any ingredient in either of the two available vaccines, now we have 3, but the messenger RNA have the Miralax or have the polyethylene glycol. So if you have allergic reactions to Miralax, polyethylene glycol, or polysorbate, you should not get the vaccine. And of course, if you or other injectable medications, ask your healthcare provider about whether you should get the vaccine. Now we're going to go over some other common questions. Are certain medications unsafe with the COVID vaccines? So far, we haven't identified any. Remember, when people were enrolled in the trials, it included people with underlying health conditions, asthma, heart disease, hypertension, diabetes, chronic obstructive pulmonary disease, liver disease, a lot of different medical conditions that might require medications. And of course, we included elderly people over 65. So no particular interactions were observed. Can you consume alcohol after taking the vaccine? Yes. What about the timing of other vaccines? It should be separated by at least 2 weeks from the COVID vaccine. So if you get the flu vaccine, you should wait 2 weeks after before you get the COVID-19 vaccine. Or if you're planning to get the COVID-19 vaccine, then you wait 2 weeks later to do any additional vaccines. Or you wait until after completing your vaccination period for the COVID-19. For Moderna, you get the first dose and then you get the second dose 4 weeks later. For Pfizer, you get the first dose and then you get the second dose 3 weeks later. And of course, for Johnson & Johnson, it is just one dose. So in the trials, protection by 1 to 2 weeks after the second dose of Pfizer or Moderna and 1 month after Johnson & Johnson. And that's how they designed the studies, to look at risk of disease 1 month versus 1 to 2 weeks. Now, it's unclear at this time how long immunity will last, because people are like, well, can I go plan my vacation now after I've gotten the vaccine? We don't have that information yet, but it does seem to provide immunity at least 3 to 6 months, at least that period of time. A person can get COVID-19 after vaccination if they are exposed and immunity has not developed yet. For example, someone said, oh, I heard a friend, she got the vaccine and 2 days later she was in the hospital with COVID-19. Well, that can happen because remember, it takes a while for your immune system to develop those antibodies that help keep the virus from entering your cells. So you remember, you want to continue to wear a mask and socially distance after following vaccination, because the vaccine is just one piece of one equipment that you might have in your toolkit to prevent COVID-19 infection. The others, physical distancing, wearing a mask, hand washing. People often say, look, I already had COVID. Do I really need this vaccine? Yes. Natural immunity, the type of immunity we get if we had the actual infection, varies from person to person. Usually after you've had COVID, you might have immunity for about 3 months, but you still should get vaccinated because your immune system promotes an even more robust immune response, meaning produces more antibodies in the setting of the vaccine versus infection. And because reinfection is possible, it is recommended that people who have been previously infected and fully recovered still get the vaccine. How about wearing a mask? Do I need to continue to wear a mask and take precautions after vaccination? Yes, you do. We do yet not know if the vaccines protect against asymptomatic infection. So far, preliminary data suggests that they do. And we do not know if vaccinated individuals can transmit virus to others. Some preliminary data suggests that the vaccinated individuals do not transmit virus to others, but we're still waiting on full data for that. This is a big one about vaccines and fertility. Will the current vaccine impact fertility? Many people think, oh, the vaccines are a form of population control. I'm going to not be able to have a baby if I get vaccinated. No, that's not suggested by the evidence. There's no scientific evidence that the current COVID vaccines cause infertility in women. In fact, some people enrolled in like the Moderna trial, they actually did become pregnant while they were in the vaccine trial. And others have become pregnant in other trials too. So no impact on fertility in the clinical trials, which enrolled thousands of reproductive age women. Women enrolled in Pfizer and Moderna vaccine trials became pregnant after receiving the vaccine. What about pregnancy and breastfeeding? COVID-19 disease is bad in pregnancy. It can increase the risk of severe illness and death. It can increase the risk of adverse pregnancy outcomes, such as preterm labor and pregnancy loss, miscarriage. No data on safety from clinical trials yet because they did not include pregnant women. Now, of course, there is a trial that is enrolling pregnant women, and we'll have good data from that soon. But no safety concerns were demonstrated in animal studies. Remember how they study these vaccines in the animals before they decide to test them in humans. And as of last report date, January 22nd, 15,131 pregnant women have received the messenger RNA vaccine, and they were enrolled in the Be Safe program, which is the CDC FDA program that allows people to share what side effects they're experiencing after receiving the vaccine. And what about pregnancy and breastfeeding? Yes, breastfeeding is safe during after you receive the vaccine. The messenger RNA vaccines are not thought to be a risk to the breastfeeding infant. The CDC, the American College of Obstetricians and Gynecologists, and the Society for Maternal Fetal Medicine state that pregnant individuals who meet criteria for receiving COVID-19 vaccine may choose to be vaccinated. Of course, you want to engage in, if you're pregnant, you want to engage in informed shared decision-making discussion with your healthcare provider. Do the vaccines contain something that the government will use to track people? I don't want to be tracked. And that's a common myth that COVID-19 vaccine syringes have microchips that will be used to track those who receive injections and the recipient's location. Guess what the truth is? COVID-19 vaccines do not contain microchips or tracking devices. When someone is vaccinated, data will be collected about when and where the vaccine was administered. So you'll see them entering that information in the computer, and you'll also be given a card with that information about the date and the time that you received the vaccine and the type of vaccine, whether it was Pfizer, Moderna, Johnson & Johnson. And you'll also be given a reminder for your second dose if it's Moderna or Pfizer. I've heard of people dying soon after vaccination. Do we know that whether their death is vaccine related? Well, recent example, Hank Aaron died at 86, about 2 weeks after receiving the Moderna vaccine. We don't know whether that was vaccine related. He's 86, of course, and as we get older, we're more likely to die, but they are investigating, the case. Data from phase 3 clinical trials, which include over 70,000, even more now that we have Johnson & Johnson, over 100,000, suggest that these vaccines do not cause death. In fact, in the Moderna and Pfizer trials and Johnson & Johnson, those that received the vaccine did not die. As of February 21, 63 million doses have been given in the U.S. and 1,099 deaths reported to the CDC. No increase in deaths was seen among people who got the vaccine compared to similar people who didn't receive the vaccine. Can I get HIV from the COVID vaccine? No. HIV is transmitted through blood or body fluids. COVID vaccines aren't made from blood, and they don't contain blood or body fluids. Do the available messenger RNA COVID vaccines use fetal tissue? No, they don't. They are messenger RNA. The Pfizer and Moderna vaccines do not involve the use of tissue from the body of an aborted baby at any stage of design, development, or production. Should children less than 18 years old, get the vaccine? Well, remember, the Pfizer was tested in individuals 16 years old and above, and the Moderna in 18 years old and above. Johnson & Johnson, 18 years old and above. So they're not approved for those children, except, Pfizer, 16-year-old could receive the Pfizer. However, studies are underway for those children 12 years old and older, and those results will be coming out, in a few months. And studies on younger children are also being launched. How much will the vaccine cost me? Nothing. The vaccine is free of charge. Now, if you have insurance, your insurance may be billed for the administration of the vaccine, but the vaccine itself is free of charge. I'm undocumented. I could get reported to ICE if I'm tested for COVID. Well, you can get tested. Federal law allows testing, screening, and treatment of communicable diseases, including COVID-19, regardless of immigration status. It's illegal to report the immigration status of anyone who gets tested. And there are many testing sites in Massachusetts, such as, the Stop the Spread program, that allow walk-up and drive-up testing. No online registration or official ID is required. And there are some, community health clinics that you can also go in and get vaccinated without, going through the state registration site. Search Massachusetts Stop the Spread for information on these testing sites. And I think I will stop there because I want to, I'll just go over the variants. What about the variant strains? Some people say, oh, I don't want to get the vaccine because, the virus is mutating and that vaccine may not even work on these new variants. Well, all viruses mutate. Flu viruses mutate twice more often than the the SARS-CoV-2 vaccine. And the three main new strains are the UK, South African, and of course the Brazilian strain, and all are in the US. And both the UK and the South African, as well as the Brazilian strain, are about 50% more transmissible than the original virus. And the vaccines protect against these strains. The beauty of Pfizer is that it was also tested in South Africa and Brazil. And the Moderna and Pfizer are testing vaccine specific for these strains. Getting people vaccinated as quickly as possible will slow emergence of new strains, because the more we have this virus circulating, the more it replicates. And when a virus makes a copy of itself, sometimes it makes a mistake. And when it makes a mistake, that's a mutation. When it makes a mistake in its copying process of its genetic material. So if we all do our part, we can achieve herd immunity. So if only a few people are vaccinated, then one person is infected and that disease spreads quickly. The green person is the vaccinated person. So you can see all these vaccinated people, and then there's one person that's infected, but that one person can infect a lot of people because there are only a few people vaccinated. Now, if lots of people are vaccinated, there are more green, blue people, and that one person gets infected, only a couple people get infected because they're surrounded. These two people are infected are surrounded by people that are protected because they've been vaccinated. So then the disease can't spread very far. So the whole community stays safe. This is what we call herd immunity. So for individuals that may not be able to take the vaccine, say they have severe allergies or other conditions that may prevent them from getting vaccinated, those that are vaccinated can protect them because of herd immunity. But we need a lot of people to get vaccinated to get herd immunity, as you can see. So I'm going to, so let me just go over this one. COVID vaccination in Massachusetts. So as of February 25th, over 1.5 million doses of COVID-19 vaccines have been administered. And of course, this is Moderna and Pfizer, because Johnson & Johnson just got a EUA, emergency use authorization, on Saturday. And so far, no big side effects. So who's eligible to be vaccinated in Massachusetts? Well, we're already in phase 2. So individuals 65 and older, or with 2 or more medical conditions, certain medical conditions, that's the phase we're in. And where can you get the vaccine in Massachusetts? Well, you can go to mass.gov and register there. And also some of the community health centers are registering there. And you can book and view appointments at vaxfinder.mass.gov. And of course, I know your church is also helping people find sites and register. And which conditions count towards earlier vaccination? Meaning that you may not be over 65, but you may have cancer, chronic kidney disease, chronic obstructive pulmonary disease, moderate to severe asthma, obesity, body mass index over 60, Down syndrome, heart conditions such as heart failure, coronary artery disease, sickle cell disease, pregnancy, smoking, and type 2 diabetes. So if you have 2 of these conditions, then you are eligible to get your vaccine. So in terms of take-home points, there are 3. 2 approved COVID-19 vaccines that are messenger RNA, and then Johnson & Johnson is the 3rd vaccine that has received emergency use authorization. The Moderna and Pfizer have protection. They give about 95% protection from symptomatic infection and hospitalization and death. And Johnson & Johnson decreased risk of severe disease by 85%. All three vaccines prevent hospitalization for COVID and prevent death from COVID. So you've got a winner if you get either any of these, Pfizer, Moderna, or Johnson & Johnson. Possible side effects of the messenger RNA vaccines: local reactions, arm pain, swelling. Severe allergic reactions are rare, about 5 per million. The likelihood of dying of COVID-19 or having severe COVID is far greater than the risk of a severe reaction to the vaccine. And of course, the safety of the vaccines are continuing to be monitored. Even the individuals that participated in the vaccine trials, they're being monitored on a weekly basis. So, and it's highly likely that a booster may be needed because of these variants that are occurring. The more people are vaccinated, the lower the rates of death and severe COVID-19 in our communities. Remember, the vaccines prevent hospitalization for COVID and death from COVID, as well as severe disease from COVID. So, and this event has been co-sponsored by the All of Us Research Program. And just want to highlight all of us. Some of you may already be enrolled in All of Us. And we're striving for diversity in precision medicine. Precision medicine is healthcare that is based on you as an individual. It's understanding how to treat a patient based on genetics, a blood test, diet, medications, or where you live. It's not one size fits all. And now I'll stop the screen share and hear your questions.
Yes, thank you so much, Dr. Chandler and Dr. Dedier. This is really good information that will provide people an opportunity to be informed so that they can make the right decision, or if they had any concerns. I hope some of the information you provided will be able to help those who are listening. We have people that are online from other states as well. One of the first questions from Crystal said, I heard the doctor say that vaccine is effective for 3 to 6 months. What's next?
What's next? Well, we have to see whether the protection from the vaccine is even longer. We know that it's at least effective for that period because of the vaccine trials, which started, you saw like Pfizer started in April and Moderna, July. So we're going to continue to follow out those individuals in those trials. And so that will give us more information about the protection of the vaccine. What we're envisioning is that people will probably need to be vaccinated every year. This virus is probably going to be around. And of course, the other layer is that the companies are working on addressing vaccines for the variants. So what's next? Probably a booster vaccine will be the next piece.
Also, you spoke earlier about even if you get the vaccine, you still wear your mask. And some people are questioning why is this important? I think you probably want to stress why the need to continue to wear the mask. I know you said it, but probably it's worth stressing again so people really get the understanding of why this is critical.
Right. So it's critical that you continue to wear the mask because remember, the vaccine is not 100% effective. It doesn't provide 100% protection. It provides some protection, but not 100% protection. Pfizer, Moderna, 94 to 95%, and Johnson & Johnson lower, but they all prevent hospitalization for severe infection. And so far, they've all prevented death from COVID in the trials. So that's why you get vaccinated, even though it doesn't provide 100% protection.
So
right.
Continue to wear your mask. Go ahead.
Can I add one thing to that answer? Yes. So that's absolutely true. And you also help protect other people from getting infected because folks who are vaccinated, they may get the infection, but they may not and do not generally get sick. So it's possible to get the vaccine, to then actually be infected with the virus that causes COVID-19, but not get any symptoms at all. So you're asymptomatic, but be able to spread that infection to somebody else who hasn't been vaccinated, not immune. So one of the reasons, in addition to what Dr. Chandler said, to continue to wear a mask and continue to social distance is so that you don't inadvertently give the infection to somebody else, even though you yourself probably won't get sick from it.
And
Someone, go ahead, Dr. Chandler.
sorry, remember the Moderna and Pfizer trials looked at symptomatic infection. That was what they were measuring. How well does the vaccine protect against symptomatic? That was the primary endpoint, symptomatic infection, and of course, severe disease.
I have someone who said this is an excellent presentation. Will it be accessible for those who could not attend? And the question is, how long does it take your immune system to start working after you have the second shot?
Right. So for Pfizer, they looked at response in terms of protection from symptomatic infection after 7 days. For Moderna, they looked at it after 14 days. So for Pfizer and Moderna, 7 to 14 days. For Johnson and Johnson, 28 days.
And how long do you have a choice in which one you receive?
You don't, but I mean, you can usually call the site and see, okay, what are they doing? And we know currently it's going to be Pfizer or Moderna, but Johnson and Johnson will be in the mix soon. But as Dr. Fauci says, the best vaccine is the one that you can get. So
That's
the important thing is to get vaccinated.
Again, we have people that are also in other states, and they also pose questions during registration. Someone asked, I do not live in Boston. How do I get on the list? I've been trying, but unsuccessful.
So you call your city public health department or your state public health department, and they can help you get on the list. Many states have a variety of ways, and the local news is advertising how to get vaccinated. I mean, I've been in multiple states over the past few months, and they're advertising right on your local TV. And so if you watch your news, you'll often see how to get vaccinated. Okay. In addition to going on the web, and if you do not have internet access, calling your local public health department. And then if you don't, you can reach out to this church that's hosting this event, and I'm sure individuals there would be able to help you find a vaccination site, because I know elderly people, their kids are helping them register from other states in Massachusetts because it's an online registration process.
Right. Okay. Yes. As Dr. Chandler said, Grace Church of All Nations is consistently posting information on our website. So you can go to gcoan.org. Again, gcoan.org for information about where you can get vaccinated or information related to the vaccine. Dr. Chandler, earlier you spoke about cancer. There's a question. Is there any information related to blood cancers and getting the vaccine?
Right. So individuals with blood cancers, depending on, blood cancer, that's a very broad term. Individuals with cancer are getting the vaccine because we know that if you have cancer, you may have a weakened immune system. So that puts you at increased risk for infection. And so you certainly want to put yourself at increased risk for COVID, because COVID would be a bad infection to have on top of cancers. So cancer patients, blood cancers, as long as, they are not undergoing, aggressive treatment, then they might decide that they don't want to add a COVID vaccine to the mix. But cancer patients are getting vaccinated in general, and blood cancers are included in those cancer patients that are getting vaccinated. For example, multiple myeloma patients.
Thank you. I have a request here from Donna Saunders. She's out of state and she's asking to be on mute so she could ask a question. Donna, can you go ahead and ask your question? Chas, could we unmute Donna?
Okay, this has been excellent. Can you hear me?
Yes.
Yes.
Okay, this has been excellent, and I do thank you for it. I have two questions. One is do they know why the success rate of Johnson and Johnson is significantly, well, it seems to be significantly lower than that of the Moderna and Pfizer? That's my first question. Should I wait to get that answer first before I ask my other question?
Sure. I mean, I can answer that. Remember, Johnson & Johnson is a one-shot vaccine, and we know that the immune system is primed even more after that second vaccine. So Johnson & Johnson has a trial underway now with using a 2-dose series. The other thing, though, is to remember that Johnson & Johnson included, that was an international trial. South Africa and Brazil were there. And of course, we had the South African variant that the vaccine was less effective against. So that sort of drove down the numbers. But the key thing is that Johnson & Johnson prevents 100% death from COVID-19 infection and hospitalization for severe infection. So across the board, Moderna, Pfizer, Johnson & Johnson are both hitting the key target, which is death and hospitalization from COVID infection.
Okay, thank you. And my second question is, we among us are mental health workers. I'm a psychologist. I know Sister Foxworth is a mental health provider, and we've also got ministers and all. How can we assist with addressing the whole vaccine issue, the fears and so forth? How can we assist with that? Given their efforts to get this information out to the people of color and all, how can we be of assistance?
I think holding sessions like this where people can have their questions answered and really engage in conversation about it, helping people register, if churches can help people register, and also help provide transportation to the sites, vaccination sites, because there's some churches in the Boston area, they've already vaccinated 80% of those of their eligible church communities. Others have been resistant. They're concerned about the safety and they're praying about it. So continue to stay in dialogue with your parishioners and, listen to them and then help them. It's very difficult to get registered for some individuals. So transportation, registration, support in terms of answering questions.
Thank you so much, Dr. Chandler.
If I may add just one thing, which I think I've been doing, if you are a clinician who sees patients, then you already have a relationship of trust with folks who will have questions, who will share those questions with you. So I think if you're a clinician who sees patients, then that's another way or an opportunity to help discuss and help people get over their fears, help point them toward vaccination.
I'm not sure if any of the doctors will be able to answer these questions, but I'm going to pose it anyway, because I've noticed that I've seen a number of churches and pastors on TV, and some churches are sites where members can go in, or community members can go in and get vaccinated at various churches. I'm not sure how this is done, but I think knowing Grace and how Grace is always informing in educating the community on various things, how does one go about getting a church to be a site for congregants and community members at large to get vaccinated?
Yeah, so
well, I'm sorry. So I work at Boston Medical Center. What Boston Medical Center has done is partner with community organizations and populations it serves, Roxbury and Dorchester, to actually host events like this. So we've partnered with Morning Star Baptist Church, for instance, at Boston Medical Center, to host vaccine drives and to help publicize these drives. I actually have volunteered to vaccinate individuals as an employee of Boston Medical Center because that was made available through BMC. So what I think you can do if you're a community organization served by a health center in your vicinity or a hospital in your vicinity is reach out to those organizations to partner with them to host events like this, because Boston Medical Center, as far as I'm aware, is actually helping provide the vaccine. I think that Boston Medical Center, anyway, I'm not sure if all hospitals have the same mandate, is expected to help its constituents in the community be vaccinated and provide vaccine for that very thing, working with the state of Massachusetts. Sorry, Dr. Chandler, would you like to add something?
No, you covered it. I mean, I was thinking of Morning Star Baptist, and they specifically reached out to pastors to get vaccinated. In fact, I reached out to my pastor, and he went over there and he got vaccinated. So when we have leaders in the community that are willing to take the lead in terms of educating the community, just as you're doing with this forum, and continuing to engage, even when people say, oh, I don't want that vaccine, remember that people will often change as they learn more about the vaccine and as they have their questions addressed.
I'm seeing that we are at the 8 o'clock hour, but we have a lot of questions. Is it okay if we ask a few more questions?
Sure.
Fine with me.
Okay. We have and by the way, thank you for answering that question. I believe Grace Church of All Nations will be reaching out to you to find out how they can be a site, because I think Grace is a pillar in the community, and I think it would be great, and that would also encourage members to feel comfortable in also getting the vaccine. We have a question from Pastor Ron Eggleston. How does herd immunity help to those who have major allergy reactions on site? I'm not sure if I can read this. How does herd immunity help those who have major allergic restrictions
Right. I mean, the goal
continue to social distance?
Right. The goal of herd immunity is to have enough people around you that are not transmitting the virus, that are protected, so that you have less likelihood of coming in contact with the virus. That's herd immunity.
Pastor Ron also has a question. Is it possible to have you do a presentation in the New York area?
Sure. I mean, we can do it virtually.
Great.
I was going to say it depends on the hotel you're putting us up at.
What about the people, those who are who have high blood pressure and diabetes? Are they at more risk to get coronavirus? That's a question.
They're not at higher risk necessarily of getting coronavirus, but they are at higher risk of doing poorly with it. Hypertension wasn't one, I don't think, correct me if I'm wrong, Dr. Chandler, of the conditions that conferred a greater risk of poor outcomes with COVID-19, diabetes plus.
Hypertension, diabetes, and obesity, they increase
and
the
obesity.
risk of disease.
Yeah, thank you. So yes, thank you for clarifying that. So that's the connection between medical conditions and COVID-19.
Nicholas.
Helena.
Yeah.
Oh, I said Eggleston had another question. He's unmuted.
Okay, Pastor Eggleston is live. So Pastor Eggleston, go ahead. You have the floor.
Thank you. Excellent presentation. The question I was actually asking about the issue concerning herd immunity is for those individuals who have, I have a couple of sisters who have major allergies, so they probably will not be able to take the vaccine. How will herd immunity help them if we are still required to social distance? That was really what I was asking.
So if individuals have severe allergies, they can still get the vaccine. The key thing is, do they have allergies to the polyethylene glycol or the polysorbate? But if they decide, oh, I really don't want to take that risk, then that's fine. But I mean, I did vaccinations, at Lewis Center, and I mean, you can, if you have severe allergies, we will just watch you for 30 minutes instead of the 15 minutes. So
okay, because they seem to be allergic to air. Just to
understood.
the second
herd immunity, like I mentioned, herd immunity is means that you're surrounded by enough people that are vaccinated so that you have a low likelihood of being exposed to COVID-19 from these people that are surrounding you, because the vaccine seems to reduce transmission as well as infection. Now, of course, we're waiting for more data, but the AstraZeneca data suggests that it does seem to reduce transmission, meaning you pass someone. So if you're surrounded by more people that are not carrying the virus, then you're less likely to get the virus. Because it's human to human transmission.
Okay. We'll also have a survey at the end. I just want to let folks know there'll be a survey posted in the chat, so we want to get feedback from folks and also some other information. I'll just take a few more questions. I see someone says, what is the effect of vaccine on IgG and IgM level?
So it's a vaccine, so that means that your body sees it, and then the immune system responds. The helper cells, rev up the B cells, and then immunoglobulins are made. So IgM is the first, immunoglobulin that's made, and then you get IgG afterwards. So initially, you get the IgM surge, and then the IgG comes up, 2 weeks later, and that persists on. And those are the levels. Those are some of the levels that we, may measure just to verify that you're responding in a clinical trial. You might measure that, not clinically when you're just getting the vaccine. We don't check those levels, but those are indicators that you have an immune response to the spike protein. So,
well, thank you so much, Dr. Chandler and Dr. Dedier. Again, this event was in collaboration with all of us New England, Dot House Health, and we are so grateful for Grace Church of All Nations agreeing to put this event together. And we have a lot more information that we'll have resources that we will provide. Also, hopefully we can share the slides with those who are not here. And if you want to host an all of us conversation for your organization, you can contact Cheryl McLeod, Communications and Community Engagement Manager. Her email address is in the chat. You can check it out. We also have Elizabeth Antonellis, who's also coordinating this event with us. And we want to ask people to continue to check the website. We have additional resources that will be provided, and we will share that with the church so that people can have more information. If they still have concerns or questions, you can also send your questions, and we will provide them with the appropriate healthcare professionals so we can provide feedback to everyone. Dr. Chandler, Dr. Dedier, is there any parting words that you would like to share with the participants?
I just want to commend all of you for getting educated about this really important topic, and I think that's really the best that you can do. And I think once what you learn here, please do pass it on. I think that would be my parting message.
And yeah, I agree. It's great to continue to engage in the discussion. And if you have not been vaccinated, continue to gather information. And for those of you that have been vaccinated, be ambassadors, be champions, share with others your experience, because we know one of the biggest predictors of the person getting vaccinated is how many people they know that have already received the vaccine. And I took the Moderna vaccine. I'm still here. I had no major complications. My 81, she'll be 82 this week, 82-year-old mother received the vaccine, no complications, and other family members have received it also. So continue to engage in the discussion.
Thank you, Dr. Chandler. Thank you, Dr. Dedier. Thank you, Elizabeth, and thank you, Cheryl. And again, special thanks to all those of you who took the time to come in to get information so you can make an informed decision about the vaccine. I hope this information was helpful, and I hope it answers some of your questions. If you have more questions, you can send the questions to the church, go to the website, get more information. We'll stay in touch with Dr. Chandler, Dr. Dedier, and all of us New England team. If you have more questions or you know someone who would like to host an event, please let us know. Again, thank you so much for taking this opportunity to join us for this very important conversation.